This is a brief lecture on congestive heart failure. Congestive heart failure is divided into two, depending on if it's the right pump or the left pump that is failed. Typically, it's always the left pump that goes out. So it'd be left-sided congestive heart failure. And in fact, if it is the case of the right pump, often the cause is that the left pump has gone out. So that's just something to note there as I'm going forward. So in the case of left-sided heart failure, the causes are going to be usually something like ischemia, hypertension. The reason why hypertension would cause this is, hypertension is when you're you have really high blood pressure, and that really high blood pressure really makes the left ventricle have to pump really hard, and so with that you get really you get a hypertrophy of your left ventricle, and that hypertrophy, basically what it's doing is it's saying, okay, normally let's say you would have had just this much muscle that needed to be oxygenated, and when you get hypertrophy, now you need this much muscle that needs to be oxygenated, and so that's a lot of muscle that needs to be oxygenated. Sometimes the blood vessels can't supply enough oxygenated blood to keep that muscle alive, and so what happens is not all the blood can get to this, and so it becomes ischemic. And when it becomes ischemic, sometimes it can die and become necrotic, and that can cause a left-sided pump failure. Also, dilated cardiomyopathy. Basically, this is where the chambers in the heart become dilated, and that puts extra stress, makes it harder for it to pump. Also, myocardial infarction. That one's obvious. Restrictive cardiomyopathy is another thing that can happen that can cause a left-sided pump failure, and with this, with left-sided, you're going to have pulmonary congestion. Essentially, you remember the blood from the lungs is going, it's oxygenated blood, and it's going into the left ventricle. And from the left ventricle is pumping that blood through the aorta and into the rest of the body. And so if it gets congested in the left ventricle, what's the backup? The lungs. And so the lungs become congested, and when they become congested, it's going to cause pulmonary edema. So it's going to get swelling, fluids build up in the lungs. Also dyspnea, with trouble breathing, as well as paroxysmal nocturnal dyspnea. So it's basically having problems at night breathing. You're going to get lung crackles on auscultation. You're also going to get something called heart failure cells in the alveoli, because what happens here is it ruptures, and the macrophages end up eating up the blood from these ruptures. And when they eat up the blood, they become hemosiderin-laden macrophages, which are a distinctive feature if you were to look under a microscope at those cells. Also, you're going to have a decrease forward perfusion and the activation of the Renin-Angiotensin-Aldosterone system. If you remember really quickly, just a review of that is, here you have your liver, terrible liver, there's a liver. Your liver is going to secrete something called angiotensinogen. Angiotensinogen then is cleaved by something secreted from your juxtaglomerular apparatus, which is called renin. Renin is released from the juxtaglomerular apparatus, and that cleaves angiotensinogen into angiotensin 1. And then that angiotensin 1 is then changed by angiotensin converting enzyme, which is excreted, I believe it's from the lungs. Angiotensin converting enzyme converts angiotensin 1 into angiotensin 2, and it's angiotensin 2 that has all the very active properties, such as the aldosterone release and the vasopressive effects and things like that. And so, but typically the medication that you're going to give to somebody for left-sided congestive heart failure is going to be an ACE inhibitor. So those are the drugs that end in pril, like captopril and enalapril, and those different ones that are going to stop. They're ACE inhibitors, so they're going to stop the conversion of angiotensin 1 into angiotensin 2. So you get a buildup here. So that would be the typical medication that you give somebody. It's one of the prills, ACE inhibitors. So there's also right-sided. So over here is going to be right-sided heart failure. And so right-sided congestive heart failure, what you're going to have here is essentially, like I said earlier, it's typically caused by left-sided. So what happens is, you remember, the left-sided gets backed up. Where's that going to go then? Typically that'll end up pushing back on the right side, and then the right side becomes congested, and then you get right-sided failure after left-sided. There are other causes, though. Sometimes it can be a left-to-right shunt. Essentially, if there's a left-to-right shunt, the blood's going from the left ventricle into the right ventricle, and that puts more pressure on the right ventricle, and then you can have those congestive heart failure effects coming from that. Also, cor pulmonale, which is the chronic lung disease. Essentially, what's happening in this case is that the right heart has to pump against the constricted blood vessels, and that's what they call the cor pulmonale. And so that extra having to pump hard against those blood vessels that are constricted backs things up. You're also going to see jugulovenous distension with right-sided, because you remember that that's basically the blood vessels that are going into the lungs, and the right heart pumps blood into the lungs. And if it's having a hard time pumping blood into the lungs, apparently that jugular vein is gonna stand out. You could also, sometimes you can get hepatosplenomegaly and cardiac cirrhosis, and that's in the instance where you see that nutmeg liver. If you look at it, it looks like it has these little brown things on it. It's a pathological sign. It's on gross examination, you can see that. And sometimes you can also get dependent pitting edema.